Everything is in one area right now, and it has been a game changer.
With growing recognition for behavioral and mental health, it's important to remember that delivering mental health care covers a wide range of services to meet the needs of patients, clients, and customers. Now, beyond routine outpatient therapy and counseling, there are crisis management, detox, and residential programs, and much, much more, each with additional requirements that are now being met by eClinicalWorks' 24-hour care setting for behavioral health module. Mental Health Cooperative in Nashville, Tennessee was the first group to implement this new module. And today we're happy to welcome MHC Senior Clinical Systems Manager Megan Isham to speak with us about how these capabilities are being put to use to deliver exceptional comprehensive services that improve health outcomes in this unique setting. Megan, thank you so much for taking the time to speak with us today.
You're welcome. Thank you for having me.
Now, Megan, tell us a little bit about MHC and what are the scope of services that MHC provides and how many people are you caring for on a regular basis?
Yeah, so we have a 24-hour unit that has our crisis stabilization unit. It has detox unit. It has 6404 unit with CTC. We also have a lot of staff that are out in the field, and we have we do outpatient and inpatient therapy as well.
Yeah, and I think one of the real key components of this is like you said, you have people out in the field. So eClinicalWorks being a web-based system, I think really gives you a lot of access to that tool wherever your teams may be.
Yes, for sure, for sure.
Now, MHC has been on eClinicalWorks since about 2018, which was well before this 24-hour care module became available. Where do you see this module having the most impact on your efficiency and care delivery?
Yeah, so we were previously using eClinicalWorks as everybody uses it now with that standardized SOAP note, scheduling of appointments on resource schedules. Now we have an episode of care. It's a full episode of care with different progress notes. It's integrated with Pyxis. We have our triage that's able to take that first call and have that full episode of care throughout discharge.
And tell me a little bit about how that changes your division of labor, for example. I think there's different teams have different workflows. If you could talk a little bit about that.
Yeah, so like I said, triage kind of starts the ball. They get the ball rolling with the consumer, so they call in or they might be out in the field. We start that first call there, starting with the episode of care. We get them registered. It is an all-inclusive on a census list, so we just kind of see where they are by their unit of what kind of level of care that the consumer needs, and that's what we call our unit. So it depends on if they're on the CTC, if they're CSU, detox unit, we go from there. Everything is in one area right now, and it has been a game changer for our staff. We don't have to shuffle through different encounters like we previously had to. We're able to see all of that in one area, and it's been great.
And I believe it's very customizable too. I think you did a lot of work to, customize the categories and your own hyperlinks within the note, didn't you?
Yes, that is one of our favorite things. So as most people know, ECW standard hyperlinks you have through that SOAP note of HPI, current meds, all of that. We created our own unique hyperlink called EPS, which is for Emergency Psychiatric Services, and it's based upon what your role is. So you will choose the note based on your role. So if you're a crisis counselor or a resident counselor, provider, nurse, and then it goes into that detail of do we need to do a crisis reassessment? Do we need to do a shift note, an admission note, a discharge note? It is all customizable and it is completely tailored to our workflows.
Sounds like it would be much more efficient for the individuals. Now they know exactly what they need to do and they don't have to worry about skipping over sections that they don't need anymore. Now, with this management that we're doing here, treating severe mental health issues, that often requires complex management of orders and medications as well, not just where you're going to document information. How has this module changed the way that you handle those aspects of care?
Yeah, so I'll just start with the Pyxis. That's been a great game changer with our EMR. So it integrates seamlessly. We have a barcode scanner. We print out the barcode bracelets for our consumers, just like if you were being admitted to an emergency room setting. And you have that wristband that has the patient's name and everything. So it's integrated in eCW where we just have to scan that barcode and it brings up our consumer. So we have order sets based upon what type of level of care the consumer is being seen for. So we have different protocols, obviously, if they're in some kind of psychosis or a very depressive disorder. There's different protocols of medications and labs that need to be ordered. So those order sets are very similar to the outpatient world, where we have all of that in there. We can just click one button and it's all ordered for us. It's also scheduled. So we can actually put a schedule with each of our medications. So maybe they need it right now, but they won't need it again in 4 hours. We can put that 4-hour time. All of that's customizable as well. So you can make your own routes and administrations.
I was going to ask about that scheduling piece with the EMR that's available in that 24-hour module. There's also some overlap between the meds on the inpatient side and the outpatient side, right? You're a multifocal group, you're multi-specialty, multi-service type group. So you're doing inpatient and outpatient. How does that communication back and forth work, especially in regards to the meds and orders?
Seamlessly. So say that we have a consumer that does get services somewhere else at Mental Health Cooperative, and they have a crisis and they need to be seen immediately and they need that extra level of care. All of their documentation is in there from their previous encounters, all of their current meds, all of their referrals, anything like that we can see. It integrates seamlessly in. So instead of it being considered current medications in the 24-hour behavioral health unit, it is a home med. So we can actually, if we don't have the consumer's medications that they're taking and they need it, they can bring their medications in with them, as most people do, and we can administer their home meds through the Pyxis and everything like that.
Of course, and I believe it helps you to decrement the totals and keep track of what you've given and what they have left and all sorts of things like that. Lots of capabilities there. And then, as you said, it's a seamless communication. So anything that you give them now, on your side, it shows up as current meds on the outpatient side as well. So it's seamless integration. Now, there's a lot of other types of orders as well, right? We're familiar with lab orders and imaging orders and things like that. But in the 24-hour behavioral health space, you have some additional unique types of orders. Talk about those if you can.
Yeah, so one of the biggest ones is our diet orders. So we don't have a kitchen on site. So we actually order our food for our consumers. And those diet orders are very, very helpful. We can print them out when we read off the orders of what we need to wherever we're ordering food from. So we have their allergies, or if they're on a cardiac diet or a diabetic diet, all of that is written out very clearly for us to be able to order. Not only that, but the ADT orders is what talks to our Pyxis system. So as soon as they are admitted, it kind of integrates right into that Pyxis system. When they are changing units, that also gets communicated to the Pyxis system. So it knows which Pyxis med bank to pick from. And those orders there have just been a game changer for us, where previously, if we had to order a medication, we might even have to send it to our local pharmacy, which we do have a pharmacy here at MHC, but we would have to, go in and put it into the system, hit send, get it from the pharmacy. It was sometimes a mess.
There's also things like nursing orders, I know, that are in that module, but you actually have another unique situation where sometimes your patients leave your site for whatever reason. What does the module have to help you out with those kinds of situations?
Yeah, so obviously we are mental health. We are not regular care. So if a consumer has a medical emergency, or maybe they need medical clearance, maybe they're homeless and they've came in for a crisis, and we think that they might have a broken wrist or a broken ankle, we can actually temporarily depart our consumers and get them set up for transportation to go out to a different medical facility. And what that looks like is it actually holds their bed. So it alerts us on our census list, kind of like with a different color, to let us know that that consumer is not here, but they still have their bed when they get back. That also helps in the event of an emergency. We know how many consumers are actually on site on the premises versus if previously, if they left, there was no way to really document that.
Yeah, definitely very important. Make sure you know where your patients are, how many patients you have to worry about, like you said, especially in a crisis like that. And that brings me to the next point, which is patient safety, because I think that's kind of what you're touching on there with some of those checks that you're doing. What other areas is the 24-hour module having on, sorry, what other areas is it impacting for patient safety?
Yeah, so everything is integrated like our safety plans. So it is an electronic record now, where previously it was a very long list of checks and balances for when we get ready to depart a consumer. We have to have that safety plan in place. We have to have those phone numbers, of who they can get a hold of if they feel like they're in a crisis again. And what are those steps to, if you feel like you need to reach out, what does that look like? Who can you talk to? All of those things. Also, with being in behavioral health and mental health, sometimes our consumers are very agitated. We had to use word of mouth previously with our staff, just like, hey, we have a C in room 24 that's a little aggravated. So now we have attributes and protocols, I guess, where it is all listed on that census list. So we can actually see that there's like an alert, and you can hover over it. We like to say hover to discover, and you can see what those attributes are. So if the consumer is agitated, or if maybe they can only be seen by male technicians, things like that.
Now we've discussed a lot of features here, Megan. Certainly there's some very big capabilities that are making improvements in your workflows. What are some of the other maybe smaller ways that this is helping your work, not just in this module, but for MHC as a whole?
Yeah, so something that I would like to touch on is kind of like the reporting aspect. There's a lot of reports that have been customized and built for us in our EBO reporting that we use with you guys. There's a lot of reports that have to go to the state, and it is very easy to gather that data to get that into the state for submissions and things like that.
Absolutely. And then what are your future plans now that we have the 24-hour module implemented?
Well, it's funny that you ask that. We are breaking ground right now on our child and youth 24-hour stabilization unit. So currently we don't have a place where we can hold those child and adolescents away from the adult community. So we're starting that, and to be able to give care to those kids in the Davidson County area that really need it, it's going to be a game changer, and we can't wait to utilize the new 24 health behavioral health module.
Well, Megan, thank you so much for taking your time here today to speak with us about this 24-hour care setting for behavioral health module. We really appreciate your insights.
Thank you. We enjoy your partnership.
If you'd like to learn more about any of the features or tools that we've discussed here today on this podcast, go ahead and check with your strategic account manager, or check out my.eClinicalWorks.com. You can also check out our other podcast episodes on YouTube, Apple Podcasts, Spotify, or wherever you get your podcasts. And be sure to like, subscribe, and share with your colleagues if you found today's conversation helpful. For the eClinicalWorks podcast, I'm Adam Salati, and thanks for watching.